So on top of the nursing shortage, how do we also address the lack of diversity in that healthcare specialty? So looking at those two things and identifying that one of the main entry points is how students are prepared at the high school level. High school is the turning point that gets students prepared for that next step in college. So how do we help increase that pipeline to increase nursing professionals and also increase diversity? And it's always better to home grow talent because you have a deeper investment because this is your family. These are your church members. These are people that you grew up with. So you want people in your community to thrive and to win.
That's Dr. Andrea Poynter, founder and executive director of Nurses Middle College Nashville, Nashville's first public nursing high school specifically designed to address nursing shortages and lack of diversity in our healthcare fields. Dr. Poynter is a nurse herself with 18 years of experience practicing and training other nurses. She was previously a professor of nursing at Belmont University. By expanding this successful model from Rhode Island, Nurses Middle College will provide students with rigorous coursework, offering dual enrollment credits and clinical experiences to help them contextualize healthcare in the 9-12 setting, and give students a head start on their healthcare careers or post-secondary pursuits. My name is Scott Campbell, and I'm the Executive Director of the Nashville Incubator, and you're listening to Back to the Whiteboard, a podcast featuring conversations with innovative leaders in the education reform space. You can learn more about the Nashville Incubator and get involved at tnincubator.org. Well, I am very excited to be sitting here with Dr. Andrea Poynter, who is Executive Director of Nurses Middle College Nashville. Welcome, Dr. Poynter.
Oh, thank you for having me. Thank you.
I'm going to start like I have with everybody to just kind of start with the problem. I think great innovators don't just like innovate for the sake of innovation. They're trying to solve a particular problem that they see. What's the problem that Nurses Middle College Nashville is trying to solve in this community?
Overarching, it's looking at the nursing shortage and how do we address and solve that problem. But on top of the nursing shortage, how do we also address the lack of diversity in that healthcare specialty? So looking at those two things and identifying that one of the main entry points is how students are prepared at the high school level. And I mean, we could even go further with getting students exposure, middle school, elementary, but high school is the turning point that gets students prepared for that next step in college. So that's the problem, is how do we help increase that pipeline to increase nursing professionals and also increase diversity?
Well, that's really interesting because I'm curious, like, what experiences in your life helped you sort of identify that that was a problem that needed to be solved or that you were uniquely positioned to solve that problem?
Looking back over my nursing career, I've had the privilege of serving as a nurse for 18 years. And I will say initially I didn't identify it as a problem until after being a nurse and being in an environment where I was generally always the minority in an education setting, in a healthcare setting, being a nursing professor, and then sitting and reflecting, like, how did I even get to this place and space in the first place? And coming through high school. So for those of you who don't know me, I won't say I'm a geek, but I graduated with honors. And as a student that graduated with honors, to have a healthcare professional in the high school say that nursing was too advanced for me and pivot me towards cosmetology, graduating with honors, it set me on that path of like, I wonder why it is, or maybe nursing is too difficult. But I still chose to pursue nursing. So there were people along the way who helped me navigate it. So here on the backside of a bachelor's in nursing and a master's in nursing and then a PhD, it's like, how do we determine who's capable and who's not? All of this is like it's a process. And what are we willing to do to help people reach that level? Instead of like gatekeeping or blocking, how do I help prepare you to get to where you need to be?
Thanks for sharing that story. And I mean, you were also a professor of nursing at Belmont University as well. And like, how did that experience sort of shape? I mean, why go from being a college professor down to starting a 9-12 nursing education high school?
Okay, let's go down the rabbit trail real quick because hopefully the story will make sense. When I finished my master's in nursing, I was a clinical educator at a hospital. And as a clinical educator, I trained new nurses coming in. So I was getting so frustrated. And I was like, what are these colleges graduating? I need to go teach. So after 3 years, I started teaching at Tennessee State University. And I was like, well, the students, something's happening with the students from high school. And I transitioned to Columbia. After 4 years, I went to Columbia State. I went to a community college. And that was when I started writing my first grant, because I was like, wait a minute, we're still having issues with diverse student groups coming in. But I'm like, I see these students who've declared themselves, their majors as nursing or healthcare. And when I pulled a listing, there were over like 400 students who had just been taking courses waiting to get admitted into nursing. They'd been there for 3 or 4 years just waiting. And I'm like, wait a minute. How did we let this happen? How did these people fall through the cracks? So the first grant that I received, and that was in 2018, 2019, was intentionally pursuing minority populations, low socioeconomic students, to figure out how to provide some type of mentorship, guidance for these students, bringing in other nursing professors. And I even brought my nursing students in to be mentors to help these students get into the programs. Now, some of them did have to transition out and go to LPN programs, but at least they were armed with the knowledge of like what the gaps were to actually get in and what support you needed to make it. So when I left Columbia State, I transitioned to Belmont University because I'd always had a passion to pursue high school. How do I get high school students ready? All of the grants that I wrote previously, we needed to do a faster return on investment. So it was like, you need to focus on college students. But Belmont opened up the doorway and they were like, well, what is it that you have a passion for? I'm like, I'm passionate about nursing. I'm passionate about patients receiving the best care. And I want compassionate people there doing it. And they were like, well, whatever it is you feel that you need to do, go do that. So I did that. I wrote another grant.
Be careful telling me that. Yeah.
That's why I'm like, be careful what you tell me, because I'm going to pursue just that. So because they gave me that freedom, the AARP and Healthcare Diversity gave me another grant to intentionally focus on high school. So for the past 3 years, I've been doing high school outreach and bringing in high school students, identifying where the gaps were, looking at their transcripts, providing tutors for them, getting them ACT prep. They were doing internships and job shadowing at the hospital. The hospitals were employing them. And then Nursing Middle College popped up, and I'm like, oh, my God, this is real. All right, let's do it. So,
I love this.
Sorry.
But it's such a good, and I think it is also an example here, like going back to our first question. You saw a need in the community, a problem that you're trying to solve, and your whole career has been really about chasing those needs, right? Like, okay, well, I'm seeing this, let's go fix this, right? And now I see this, let's go fix this. And just for the folks who are listening here who don't know, like Columbia State is a community college or a 2-year, and having spent a lot of time in the post-secondary space myself, I mean, that's a problem when a student is spending 2 to 3 years in waiting to get into a nursing program. What they intended or expected to be a 2-year program at community college is turning into 4 or 5
or 6
years,
yes.
right? You know, and that's an issue, right? And I think it's so important that you're getting ahead of the problem to some degree. And tell me a little bit about that. Like, what's the experience of, what will be the experience of a student at Nurses Middle College? Like, what will they be leaving your high school with? What experiences or credentials that you're going to be providing to them?
Okay. Before I go into that, I do want to preface in saying that experience is not unique to Columbia State. You see it at a lot of different community colleges where students they don't investigate and don't invest in making time with advisors. So
it is an issue across the country,
yes,
right?
Yes.
I think the community college is a great option for students if they sort of understand what the pathway is and what they need to do. And the fact that there just aren't enough spaces in the nursing programs that are community colleges. They would want to accept more, but they just can't for many reasons.
Correct. So, and pay is a huge issue because for nursing, I made a whole lot more money in the hospital. So that's always going to be an issue with bringing people from industry into the education space. Yeah. So with this high school, the goal is we already know that we're coming into a population of students that are performing below grade level. So the goal is we're intentionally pursuing those students to get them to where they need to be so that when they leave from the ninth grade, they're reading at grade level or higher, math performing effectively at grade level or better, so that when they get to the 10th grade, they start doing more rigorous courses. Healthcare nursing is infused in all of the courses for the students. When they get to the 11th grade, they start their dual enrollment. So it's non-negotiable. At this high school, these students are going to be dual enrollment credits because that's another thing. College debt, oh my God. It's a lot. It's overwhelming.
Yeah.
But I know you want to make sure you provide those opportunities. So if I can provide and get these students into school, especially while they're in high school, so that they understand and know the rigor of college and be able to bypass that debt, like that's generational shifts that brings. So these students, dual enrollment 11th grade, they'll finish their CNA certification 11th grade. Our healthcare providers, HCA has been a major partner with us in this process. Vanderbilt has been a major partner in this process. So we have a lot of healthcare partners that have come to the table who are like, we'll help create jobs for these students so they get the student experience. And they're also going to do clinicals, and they're providing mentors and internships for these students. NHC has also come on board, Ascension Health. Like, we have so many partners who are providing these wraparound services for these students to help ensure success. So 12th grade, when they're graduating, the goal is 12th grade, pretty much all dual enrollment credits. So when they graduate, they will have college credits. They will have a CNA certification. If we can give other certifications like EMS, we're going to make sure that they get that certification so they're workforce ready, they're college ready. So
that's so exciting, right? So, if a student, makes the choice when they graduate that, like, I'm just interested in being a certified nurse assistant, that's a CNA, and that's sort of the pathway I want to take, or I need to take for my family at this sort of point in time, they can jump off and already be in that job because they have the certification, they're ready. But the big vision here is that students are pursuing this long-term nursing opportunities that's going to require a 4-year degree, but they're coming in to college having already completed a lot of the prerequisites that gives them a huge step ahead of other students. That's really exciting. And I love talking about sort of the partnerships and relationships that you build in the community, because I think when we think about these types of innovative schools, we need innovative solutions in the workforce. And partners, like you described at the very beginning, the problem you're trying to solve is a major shortage. Partners are dying to have really high quality, talented students, and coming from diverse communities, coming from our community, right? We're having to outsource in Nashville so much of our talent around this because we haven't been able to sort of homegrown it.
And it's always better to home grow talent because you have a deeper investment, because this is your family. These are your church members. These are people that you grew up with. So you want people in your community to thrive and to win.
Yeah. So you're not the first nurses middle college in the United States. The first nurses middle college was founded in Rhode Island and has been really successful and gotten a lot of great results in driving young people in Rhode Island, particularly coming from low-income communities, into the nursing field. And so they've started to expand that model, and they built a school in Albany, and now this is their first sort of foray into the South in Nashville. So obviously they're like a driving inspiration behind this model, but you are your own independent 501c3 nonprofit. And so I'm just curious, outside of, your CMO, the Central Management Organization of the Nursing Middle College in Rhode Island, like, what are some other inspirations for you? Who are other people or other places that you've seen or heard of or read or researched that are really influencing what we're going to see in Nurses Middle College in Nashville?
Nurses Middle College has the privilege of being part of, with Bloomberg Philanthropies, where they funded about 10 separate projects for health programs that they've spread throughout the United States. And every year, intentionally, they bring us together to meet with the other school founders and to hear what they are executing, even having a focus in rural America to be able to provide more medical doctors. And they're pursuing low income, where it's almost like a boarding school where those students are living on campus, a high school. I'm like, oh my God, this is amazing.
Yeah.
And the goal is we want to make sure that these students always have, there's no food insecurity. They have a place to sleep, to live, to be able to function and do what they need to in school, but keeping their families engaged. Like, that is very inspiring to me. Just thinking about different experiences that I've had in my life regarding healthcare and thinking how things could have been different had I not had this experience. That's inspiring to me because I think about all of these other students who will now be able to shift experiences. For example, I have a family member, I guess, called me after like the third or fourth visit to the emergency room after delivering a baby. And if anybody's looked at statistics for Tennessee, our maternal fetal rates are poor in Black and brown communities. And it often seems like a topic that's overlooked and not addressed. My family member came to me and she was like, something's going on. Like, I'm still losing blood. It's like, what is the like, I don't know what's going on. I keep going to the hospital and they keep sending me home. Because of what I've been able to do, the doors that this degree has opened for me, the jobs I've been able to access. I just happen to be living next door to an OB doctor. To be able to have that opportunity to have a connection and relationship. I taught some of those students that currently worked at his practice to knock on his door and say, hey, I have a concern with a family member. And him say, hey, have them meet me at the hospital. Like, how often does that happen? Like, how often, what would her story have been had she not had a family member who had a connection in the hospital, who had a connection with other healthcare professionals to address the issues and concerns? So I will say probably my greatest inspiration is to be able to provide that access for people to be agents in their own healthcare for their families and for their communities. Hope I answered that.
Oh, it's so great. Because, well, I mean, it shows two things. One, your lived experience and, you know, what you've learned, both by being a nurse, teaching other nurses, doing the work that you were describing before with schools and young people, trying to inspire them and mentor them towards this. Just your lived experience as a family member, as, you know, a sister and cousin, and you know, and seeing how some people are able to sort of access the healthcare they need, and others are not, and there's a knowledge gap, and there's a, as you point out, sometimes a connections gap and a relationships gap, and that you're going to be opening up these doors for so many young people that they know if they are not themselves the ones sort of serving or being able to solve the problem, they know how to get the help that their friends and family members may need. So important and inspirational. So thank you for kind of sharing that. And also just exciting that you're getting to work with a bunch of other really smart people doing similar stuff across the country.
Very smart people, let me say.
Well, you're one of them. So Nurses Middle College will open in the fall of 2025. We are not that far away at all from your first ninth grade class. It'll open just with ninth grade, and then it'll build one at a time. And if I were walking down the hallways with you, Dr. Poynter, and you were to paint me a verbal picture of what we see going on at Nurses Middle College, go ahead and tell me a little bit. What will we see when we walk down the hallways this upcoming fall?
Let's see. Are the students going to be in class or in the hallway?
That is up to you.
So I'd say if we were touring and walking down the hallway, my hopes of what you would see would be educators in a school setting, providing education through a lens of health to students that are not just sitting in class, but they're engaged in class. They're doing hands-on activities. They're making the connection between health and their lives and what they're learning so that it doesn't feel like, well, I have to learn English. Oh, yeah, you have to learn English, but let's talk about English and let's look at it through the lens of health. Oh, we got to learn this history class. No, we're going to learn about history, but let's talk about the disease processes that were happening during this time in history also. So being able to bridge what they're learning, why it matters, and how it prepares you for the next level, I hope that's what we see when we're walking through is engaged teachers, high-quality teachers, and students that are engaged and excited to be there.
That's exciting, that contextualized learning, you know, where they understand that I didn't just go to my one nursing class and then go to an English teacher, math teacher, or social teacher who knows nothing about what I just learned in that class. Those teachers might actually be sitting down and planning out how projects might cross each of their
Absolutely.
courses along the way. Fun. I'm excited to see it.
Me too.
So this is a fun time to be able to interview you because you don't have students in the building yet. And just in a few short months, there will be kids showing up in their scrubs on the first day of school and having an opportunity to be part of this really great community of Nurses Middle College. What are you hoping to learn in the next year? What's the next problem you're trying to solve?
Well, one of the biggest hurdles that we've recently overcome, we signed a lease for our incubation space.
Great.
So working towards our long-term plan. So like that begins now because the expectation is we're only going to be there for a temporary time. So I have to start preparing for that now. I can't wait until after we get kicked off. So that's something I'm looking towards. And I will say, while you were asking, I thought about the parents, because we're trying to provide this educational opportunity to the students, but we're also trying to provide services to the parents, especially parents who might not have thought this was an option, like what type of after-hour program, CPR training, community resources, what can I provide to them? So I know my mind will shift to how can I assist them so that they can better assist the students to accomplish what they need to.
I love it, right? You have a job fair for the students and the parents get to come too, and some of them may actually find the next career or job in healthcare that they weren't thinking about. And it's really exciting to think about the future of like the long term. I mean, I think this is sort of one of the underestimated what it takes to start a school is you're always dealing with what's in front of you, but you always have to keep your eyes on what's ahead. And so even as you move into a school, you're inviting families into that space, you're getting to build and design the permanent space for the future of Nurses Middle College that will last for
forever.
many, many years in this community. That's really exciting. Well, if people want to find out more about Nurses Middle College, if they want to enroll their son or daughter, if they want to just ask you a question, what's the easiest way to do that?
Well, I am available. You can go to NursesMCNashville.org, go to the website. We have a Facebook page. I'm on LinkedIn. We have Instagram. And if Belmont University knows how to get in touch with me, Scott Campbell knows how to get no. But we have those different social media sites and websites where people can reach out. And I'm on them, and I do respond.
Awesome. Well, please do. This school is meeting such an important need in our community. It's meeting such an important need in our workforce. And I think the most important piece of it is it is going to change students and families' lives, right? Transforming our community in really meaningful, powerful ways. And I can't thank you enough for the hard work that you just have put into these past couple of years of building this, but over your whole career of like care and love for this community in serving some of its most needy students and families. So thank you.
No, thank you.
And thanks for spending time with me today. Looking forward to walking down the hallways with you soon.
It'll be exciting.
All right. Thanks, Andrea.
Thank you.
Thanks for listening to Back to the Whiteboard, powered by the Nashville Incubator. Learn how you can get involved in helping us reform education at tnincubator.org. And if you like this episode, please follow, rate, and review this show wherever you listen to your favorite podcast.